Thank you for joining us for Community Conversations with Digital Pride from the Louisville Pride Foundation. This series is brought to you by UAW Local 862, Dorton Healthcare, Connolly Law Offices, Evo Mortgage, and the Fairness Campaign. Our topic today is the impact of COVID-19 on immigrants and refugees, and we have with us today Edgardo Mancia, the Executive Director of the Americana Community Center, John Kohlinger, the Executive Director of Kentucky Refugee Ministries, and Karina Barrias, the co-founder and Executive Director of La Casita Center. So let me bring everybody up here. All right, thank you all for joining us today. And what I want to do is have each of you all tell us just a little bit about your organizations to start. So Edgardo, do you mind going first?
No problem. Thank you for the opportunity to be with you. Long time don't see you face to face. I remember some comments about snow several years ago that you were very kind to fry me in public. Americana Community Center started 27 years ago. When I started the center, we have a very simple apartment and principles that we keep through the years. Human dignity, social justice, and provide holistic services. Those principles are our guidance to keep serving people today. We provide educational services, emergency relief services, mental health services. We have a partnership with the Family Health Center, so we have a clinic in the place, after school program, mentoring, STEAM programming, yoga, all the things that can provide a holistic view of the person. We serve immigrants and refugees and low-income families. So for example, with the GED classes, we are targeting people born in the United States, neighbors who need to finish or have a certificate for high school. But again, the three principles are the ones who are leading our service to the community.
Can you hear me?
Yes.
Yes, sorry, I was muted when I said yes.
Couldn't hear you there, Mike, so thank you for the invitation. KRM, Kentucky Refugee Ministries, we were founded in 1990, so we're marking our 30th year. In 97, we also opened an office in Lexington, so from our main office here in Louisville. We're a refugee resettlement agency, so we've been resettling refugees who are legally admitted through the U.S. State Department program based on well-founded fear of persecution due to race, political opinion, religion, or national origin, or membership in a social group. That would also include individuals who are persecuted for sexual orientation. We also have 6 immigration attorneys who help people apply for asylum under the same criteria. People coming from Central America or different countries through the border, and our immigration attorneys also help people apply for green card, citizenship, bring family members, reunify with family members. I can note we've also in Louisville had a big Cuban migration program for better than 2 decades. Assisting Cubans who migrate here and who've been for most of that time treated as refugees, although now they're subject to the same restrictions at the border and detention as other migrants. We've got 50 staff here in Louisville, comprehensive services. We focus on case management, medical and mental health services. We have a big youth services program in partnership with JCPS. We're very proud of kind of the robust employment placements we have for refugees at close to 200 businesses in the Louisville area. We do educational programming, ESL, citizenship, and we have some specialized programs for refugee elders, victims advocacy through a VOCA grant, which we can assist any immigrant in Jefferson County who's been a victim of a crime, and citizenship. That's I think we have numerous citizenship classes each week in helping people become naturalized American citizens.
Thank you, John. Karina, will you tell us a little bit about what happens at La Casita?
Absolutely. Buenas tardes, good afternoon, good morning, good evening, whatever time people are to us and looking at us right now. La Casita Center is a Latinx-led organization, and we are, you know, when people ask me what is it that we do, what I tell people is like, you name it, we do it, and if we don't do it, you know, we make it up at the moment. You know, every single case that we get to our doors is unique, and that's how we treat it, you know, with the Latinx flavor. So for us, hospitality is the basis of everything that we do to accompany our families. You know, we do, well, pre-COVID, part of our hospitality programs was to support our families with breakfast, lunch, clothing closet, a food pantry. Currently, right now in COVID times, we are accompanying our community from Monday to Thursday from 10 a.m. to 7 p.m. And we are providing all kind of accompaniment that we are that we have the availability to provide. Among them, we still are continuing providing free legal clinics with pro bono attorneys. We are providing mental health. We are accompanying families and individuals that have been diagnosed with COVID. We are sharing food. We are trying to be present as much as possible, answering the phone. We are doing the census. We are distributing information, how to protect our families and ourselves, and how to, you know, take care of each other, take care of our community, take care of our families. Something that the community knows a lot about us is that we not only serve in Spanish and English, but we also accompany some families that speak Quiche and Mam. Those are languages that are indigenous from Guatemala. And basically, you know, our spirit is to make all the resources and all the different services out there available, as well as culturally meaningful to the families that we accompany.
Thank you very much, everybody, for telling us about your organizations. For those of you all who are joining us, if you want to make a comment or a question if you want to ask a question in the comments, we'll be sure to get that to everybody. I've been putting the websites of the different organizations in there as we've been talking about them. Karina, you mentioned this, you spoke to this a little bit, but how is COVID-19 impacting your work and how you serve? Is there anything else you want to add to that?
Well, you know, it was kind of, I'm pretty sure that all of us that accompany immigrants and refugees, we had to move all our accompaniments, our services from face-to-face to phone or social distancing. So, you know, that has in so many ways impacted, you know, how we, most of us Latinx people in our community, we relate to each other. We are a community-oriented group of cultures where being in community is very important. So we have had to be very creative in how, you know, make ourselves present to the families. We have seen the growth of the need of the accompaniments like the ones we do at La Casita. Usually, you know, pre-COVID, in average, we will provide 550 services to, you know, anyone that will come to us in a week. Right now, I can tell you that in the first 2 weeks of COVID, every week was more than 900 services per week. So that just tells us, the impact and how much a lack of resources or information or how much need there is out there. Also, because of a lot of the families that we accompany do not read and write in any language, don't have our, internet and websites and Facebook are things that are not available to them. It has been hard to some of them to know what to do, where to go. In the first 2 weeks, we did have families calling, asking what is going on. Why is it that there is no school? Why is it that there are a lot of people in the supermarkets? Why can't we find food? Why are things closed? And that just tells you, in so many ways, how important it is, to make all the information out there in ways that people can receive it and can impact and they can learn from it.
That's a really good point. John, how has this impacted the services you all provide at Kentucky Refugee Ministries?
Yeah, I alluded to employment, and again, we've been employing like close to 500 people a year, and there are many refugees working in critical jobs, environmental services, healthcare, logistics and distribution, and a lot of former clients who are truck drivers. So many are holding their jobs, but we've helped over 50 clients apply for unemployment insurance, and I'm sure that's going to continue the layoffs. And like other Kentuckians, with the system being so overwhelmed, people are waiting on that critical benefit. We're doing a lot of food distribution, food scarcities. Always been an issue, even with the economy strong pre-COVID. So that's a big undertaking that all KRM like Americana and La Casita are involved in. I will do want to follow up on something Karina alluded to. All three of our organizations, we've put an immense amount of time in helping students, immigrant and refugee students, be in a position to participate in non-traditional instruction, and there's certainly a digital divide among immigrant communities, and I think JCPS has done a place of trust in us, and they've done some good outreach to try to make sure families have Chromebooks and laptops and the materials they need. But it's a struggle. I mean, I've talked to a lot of American-born parents who are struggling with this remote instruction, and we have some households that have 3, 4, 5 school-age children, all sort of fighting over one Chromebook that JCPS distributed to them. So and along with all the tech, the tech and sort of login issues, but it's trying everybody's patience, but there's been some good collaboration there for sure.
It's important for us to have organizations like your all's in our society to help fill those gaps where JCPS can't necessarily deliver all of that. So I'm really grateful for you all for being there for that. Edgardo, how has this impacted Americana?
Well, everyone else, we are trying to create a plane and fly at the same time. We had to change almost everything that we were doing. The center traditionally is open from 8 a.m. to 9 p.m. Now it's closed and open at the same time. We start to deliver meals to kids. We are serving over 200 kids under 18 for breakfast and lunches, and another 200 in the afternoon for supper. We translate into, I think, about 15 different languages, all the CDC instructions, and have even a cartoon for kids under 5 in different languages. We share with the other agencies all the tools that we have. We have to do after a school program by Instagram and by internet, knowing that many of our families don't have access to internet. We work with Jefferson County Public School. They're even not just the Chromebooks, but the hard copies. And also, we are working with them to create videos, because you can get the Chromebooks, but you don't never touch a computer in your life. So had to create some kind of minimum education to provide, the resources that the parents need. That is independently of the stress to have a child doing homework by internet. So it's getting worse. We fill up a lot of unemployment requests, keep doing mental health counseling through the internet, mentoring, and trying to find ways every day. If you check our Facebook page or Instagram, you will see the staff creating videos and ways to teach the kids and parents how to survive this, explain what is COVID-19, and again, all these things that we know what we used to do, or do it that way. Traditionally, we have over 700 adults at the center every day, and about 220, 250 kids. So it's a whole adjustment. When I go to the center, feel the space empty, no voices, no screen, no running. We keep working in a community garden that we have. We have a wonderful person working with us, and she developed how you have an organic community garden with preventions and social distance and all the things that we're supposed to have with masks and all the stuff. So it's again, you adapt or trying to use the resource that you have to serve the community. As long as we are serving, we are okay. But it's an impact. It's an impact in money. We lost 3 huge fundraisings in the last 5 weeks. We are facing, probably we are going to miss the festival in June. That was a festival for 30 years that we have. So probably we'll go to September. I don't know how we are going to move the dates. So this is adjustment because the traditional fundraising is not there. The money is coming from different ways and it's less money. You have staff that need to keep working and need to get getting paid. I stress out because you need to take care of yourself and your family. So it's again, it's a good time to be creative.
That's the optimistic way of looking at it. Is it's a good time to be creative. I think what you said, you're building the airplane as you're flying it is pretty much describes the situation we're all in. 2 comments I wanted to share. Lily Hernandez says, thank you to Karina Barrias for everything you do. And Tobin Williamson reminded me that anybody in Louisville, international community included, who are looking for work right now can check out the jobs board run by Kentuckiana Works. It's updated daily with people who are hiring. And that's kentuckianaworks.org/jobs. And that's in the comments, and it's on our website. At LouisvillePride.com, we have several resources available for people to direct them to places that are hiring or places that need volunteers or things like that at LouisvillePride.com/COVID-19. I want to ask you all get into some specific questions here. One, of course, I guess the first question, because we're dealing with a health crisis, is do most immigrants and refugees in our community have access to health care? And if they can't afford it, what resources are there to help them? And I will let anybody who wants to grab that one take it.
Well, if I may share my experience, I do not pretend to talk on behalf of every single immigrant or every single refugee in the city, but what we have seen. Most of the families that we accompany are uninsured. And most of the families that we accompany, going to the doctor is a luxury, where most of us come from. Going to the doctor was only for the rich, or it was not available because people had to walk for hours and hours to get to a health center. So it is not in part of who we are getting access to that. However, there are wonderful partners in the community like the Family Health Center that they have done an amazing and tremendous job in being culturally accessible, to the community at large. So they have been really good at not only putting, information out there, in different languages, but also, when people approach them for them, to get the information. It is very hard, again, because people, because of the environment right now, people are really scared. People feel that something bad is going to happen, and it is not that. Maybe the health centers or maybe the hospitals or the clinics are, doing anything inappropriate, but the environment that we live right now, what we see in the news, what we hear from others, really creates a fear of looking out for services. So as La Casita, that's something that we try to do to facilitate that connection and to ensure, to assure to our community, the different places where where we know they are going to feel welcome, where we know they are going to get what they need. And we are also, advocating to the different places for them to provide interpreters, but it's not only, having someone that speaks the two languages. It's somebody that is trained in social justice, is somebody that is trained in language justice, and is somebody that understands the different cultures that we all come from.
And on top of that, I would imagine in a healthcare setting, they need to be trained in healthcare itself. And I know that's an issue that's come up with healthcare workers not getting protective equipment, which is and also an issue for translators for American Sign Language. With the masks, people are not able to see. It's one of these. This is a situation that really reveals all of those complicating factors that make things about society so difficult. John, did you want to chime in on that?
I did, and certainly a majority of refugees are on Medicaid, and we have 2 medical caseworkers, that medical case management, helping refugees access medical care is a specialty area of ours. And so we receive, a good number of refugees who have serious pre-existing medical conditions and need to access specialist care. And like Karina, I do want to acknowledge we have some wonderful partnerships with Home of the Innocents, Open Arms Clinic. Do our pediatric health screenings, and also the PCP for refugee kids, and certainly family health centers. But we found it very difficult to access care for non-COVID-19 related conditions, some of which were serious, a lot of cancellations of appointments, and and I know healthcare workers are on the front lines, and there's some anticipation of being overwhelmed with COVID-19 cases. But I think kind of even for us, accessing medical care is complicated, I think, for immigrants to try to get critical care, not elective care, not preventive care, but critical care is more challenging during this period. And I would also echo, we've all, in Louisville, we're fortunate to have a great core of trained interpreters, people trained in medical and legal interpretation and social service and mental health settings. But with so many organizations and providers being closed, and people not being able to use in-person interpreters, language access has become an issue. So I'll just, not to plug KRM, I can plug any Catholic Charities. They have an outstanding language services office, as do KRM and other providers. If there are any providers or business owners or anybody that is interacting with immigrants and refugees and needs language services, I encourage them to turn to one of our organizations for assistance, because it's tough going for immigrants right now to be heard, to be able to talk to someone, especially at this time.
Edgardo, do you want to add anything to that?
Yes, a couple of things. Number one, echo everything that Karina and John say. The thing is mostly about social class and social injustice. Because if you don't have access to a doctor in regular way, you can imagine what is now. Secondly, the interpretation piece is amazing, important, but it's also about cultural humility. How you can access a service that treats you with respect and also with dignity. Second, the other thing is we are really blessed in Louisville because we have family health center. We have a clinic in our space. So I can tell you by first-hand experience how these people work trying to solve situations that in other places will be absolutely impossible to deal with. But now, like John mentioned, interpretation mostly has to be by phone. And it's expensive, can be done, it's expensive. But if you have trouble to understanding my English, you tend to imagine how hard it is to speak by phone and trying to understand what I say, and I need to understand what you say back. This is my own experience. After 30 years living here, I don't like to make phone calls. It's just, it's stressful for me to make a phone call. I make phone calls all day long, but it's stressful because I can see you now, and I can see if you understand what I'm saying or no. When I am on the phone, at least it's a face phone call, I don't have a clue what you understand. So you add this tension, you add the lack of knowledge about how the system works. In the United States, you're supposed to be sick and go to the doctor office. In Buenos Aires, I will call my doctor and the doctor will come to my house after office hours. Because if you have fever, you have fever. You're not supposed to be on the street. So understand the system. We have people coming from countries with everything is paid by the government. They go to the emergency room and then you have a nice bill over $2,000 and it's no way that you can pay it. So it's this kind of adjustments to a different way to seek health. And most of the internationals, refugees, immigrants, both, we are probably more focused on natural ways to resolve illness, a tea, a massage. We don't go straight to the antibiotic or straight to whatever painkiller you want to give me. So it's a whole different perspective to deal with high blood pressure, diabetes, and all the things that are part of the best to this craziness.
Thank you. Yes, that's a very good point. And I think this is one of those things that also exposes why healthcare is a public policy issue and not just a private issue. There's an attitude amongst a lot of people in America that it's, healthcare is this precious commodity and only certain people should get it. But COVID-19 is really showing us that if we have a portion of the population that's not getting adequate healthcare, something like this can spread through and impact everybody. John, you mentioned, you kind of spoke to this a little bit, but a lot of people are working from home. A lot of people are not working, but a lot of people are still working on the front lines in essential jobs, which is everything from first responders to grocery clerks and people like that. How many immigrants, how many refugees are working in those sorts of situations? Edgardo, do you want to speak to that?
Well, I would say that most of the internationals are working in factories, are working in UPS, are working in other warehouses with social distancing.
I think I'm going to stop. I think your audio, it might just be me, but I think your audio is distorted there. You might have a bandwidth issue. I'm going to go to Karina and then we'll come back to you.
Most of it, what we've seen that people, the different industries where they are, construction, yard work, restaurants, and the horse industry. So what we have seen is that people that are in construction and in yard work are continue working. Some factories are still working, and some of our concerns is that most of those hardworking people are not getting the preventing measures like masks, like gloves, or are not being explained, stay away from each other. And because people are so scared, and because people, most of them, if I may say, are not eligible for any government relief, working is the only way. For them, to feed their families and to pay their bills. Some of the other things that we have seen, for example, is our amazing governor has said, nobody is going to be evicted. But we have had cases where the landlord has said, well, even if the governor said that, when this is over, you're going to be out, or I am going to call ICE on you. Without knowing if people, what is that going to do to people, because, anyone can tell me, you can look at my hair color, my skin, my accent, and somebody can also threaten me. And regardless if you are a US citizen, a permanent resident, or you have documentation, that's a threat that we take very seriously, because that puts people in danger. It doesn't have anything to do with immigration status. It has to do, with the fear that we have. We had people, and I'm not talking about politics, I'm talking about facts. I've had US citizens that have been deported. We have had Puerto Rican people that have been in immigration jail because they don't speak English. So, we take that threat very, very seriously. So those are part of what we are seeing right now. People have to work. There is no other option. I really commend all of our siblings organizations. We are all, at capacity sharing food and resources, but, we are also pretty limited to reach out to all the people that we have out there.
Thank you. John, do you want to speak to that?
Yeah, as I said, we have, most refugees have been holding their jobs. Some, fortunately, we didn't have a lot of people working in restaurants and who had to close. I do think there was a period there, late March, early April, where different businesses were struggling to put proper precautions in place. And so that was just part of our overall going back. We're all intensively involved in giving information and communicating with our clients about what this all means and what proper precautions should be taken, and putting out information in their native language. But they're refugees and immigrants are traveling through different kind of environments, including workplace environments, where, as well as getting mixed messages from political leaders. So and some of them have just recently arrived, and they've come through, be it harrowing journeys to the southern border, or coming out of kind of horrific wars. Just processing the severity of it and understanding is challenging. So I think we're in a good place with most of our employers, but again, certain employment places of employment, you have a lot of people working in close quarters are inherently risky. So hopefully there's not we don't have outbreaks kind of among our clients working in those places.
John, for people who are refugees and have that refugee status, are they able to collect unemployment? Will they be getting any of the stimulus money? Are they able to get any of those benefits, or are they barred from that?
They are, and that's a big, for viewers to keep in mind, like refugees, particularly those who've been here a longer period, they may have worked and be getting have gotten a tax refund, and then they're eligible for the stimulus checks. and they'll have worked long enough to be eligible for unemployment insurance benefits. I know there's been some leniency about the time you've had to have worked to collect unemployment insurance, but some undocumented immigrants not eligible for any public benefits are not eligible for that. There's numerous and generous public benefits I just listed. They're in a whole different circumstance of hardship. And
Edgardo, let's see if your microphone is working again. I want to ask you about, we've talked about this a little bit, but are immigrants and refugee families impacted more severely by what's going on, and what are some of the reasons why?
Let's try the mic working.
I think you're still, are you all hearing that too? I think it's always hard to tell where the feedback is. I think you're still having trouble there.
Okay. You are agree. I'm getting out. I'm coming back.
Okay. Let me not mute myself. Karina, do you want to speak to the, in terms of immigrants who are documented or undocumented, what are some of the public assistance that they're able to access? How much does that change for people depending on their situation?
Mike, I want to share with people that most of us, I would say 99% of immigrants, we pay taxes. And a lot of people that are paying taxes right now are not receiving any relief because the rules that are out there are very limited to all of them. We see it, for example, I was a permanent resident for 24 years, and I have been, before I became a US citizen, I was paying a Social Security. God forbid something would have happened to me back then. There was no way I could have collected Social Security. So, that's part of the reality of a lot of people. We have hundreds of families paying, taxing people, hardworking people that are contributing to our community. They are not eligible for anything. Every circumstance is different, and it's a very complicated topic. But there is a lot of restrictions for people in general.
Edgardo, hopefully you're back now, I think. Can you tell us about how this is impacting some of the community, why it's more severe? And also I'd like to hear about the group of, I believe it's a group of women that you all have that's making masks.
All right. I hope that is better.
Very good. Excellent.
Good. So we're talking about the impact on the families. Number one, I was thinking is the lack of knowledge about the system. Secondly, is the immigration law. It's one of the things that people don't understand or don't know the immigration law. And until we don't have a huge reform, we cannot fix what is in the books. There are several things that sometimes I run in my head against the wall. That, for example, if you are a member of the LGBT family, you cannot apply to come to the United States as an immigrant. And people don't know that. And it's like how you can keep living in this society. So this is one piece. The other piece is the public or the environment, society environment that we are living. There are people who are wonderful and people who are insulting, attacking, bullying us. I show, and with Karina, sometimes we go to meetings, and we show our passport. And I driving, every time I get my house, I driving with my passport, just in case, because I don't know when I'm going to be stopped. So you have the element of fear on the top of everything else. However, the international community is willing to give away what we don't have. It's not that we had 2 blankets and give one away. If we have 1 blanket and we get the blanket away, it's a totally different thing. And you asked about the group of female women who we call fiberworks. This is a group of women from Iraq, from Congo, from Mexico. I'm missing another country, from Latin America. I think they're Guatemala, but I'm not sure. Anyway, it's international. And they are making even masks. We donate over 300 masks to the University of Louisville. We donate masks to people in the neighborhood or people working. We know that will be facing interaction with other humans. So they are just at home making masks. And through donations, we ask for cotton stuff. So they really create masks. And the point is how we can serve. The goal that they have is, we are here, we are part of the society, this is our hometown now, and we want to be part of the solution. At least to put something to help people who need a mask to be working, interacting with other humans. So that is the concept behind. And it's a cultural concept. We are not so worried about the me, myself, and I. It's worried about we, us, and that changed the whole perspective about how you face life and how you face the challenges that are in front of you and you need to deal with them.
I think, yeah, there's definitely a strong strain of selfishness in American culture, which we see with hoarding and all these things that happen. I just want to remind everybody that you're joining us for a community conversation as part of Digital Pride from the Louisville Pride Foundation. We do these Tuesdays and Thursdays at 1 p.m. Last week, we talked about the court system and we talked about mutual aid and community response. And Thursday, we're going to talk with Dare to Care. All these are available on our website, louisvillepride.com, shortly afterwards for viewing, and you can share them on Facebook. I'd like to ask you all about what can people do to help your organizations? You know, what is it that you need and how can people provide that? John, do you want to start with that?
Sure, and if I could strike a positive note, I do think in this, we're all connected in this public health crisis, and so we're seeing a sort of communitarian ethos, some concern among, for all vulnerable members of our community, including refugees and immigrants. So more and more people, this past few weeks coming forward and saying, how can I help? And we do, if you go to our website, kyrm.org, we do have Welcome from Home. It's sort of a virtual volunteer opportunity, and we've always utilized so many volunteers at KRM, kind of having direct contact with refugees and immigrants. We can't do that right now, but there's some innovative workarounds, and certainly we're received a lot of much needed donations of home supplies and money. We're paying a lot of rents, we're paying utility bills, we're helping families in need. So just trying to be there for clients during this. So
thank you. Karina, how can people help out with La Casita?
Well, as John said, we all have so many needs, with food, financial support. We need a lot of volunteers that help us distribute out, the food baskets that we are giving out in the community. So there is so many ways that people can accompany us and share with us, their time, their talent, and their treasure. They can visit our website, www.lacasitacenter.org. And I also, would like to invite anybody that is joining us and listening and watching this, it is very important to support all of us that are doing this work: Americana, KRM, Catholic Charities, Adelante, Backside Learning Center, Doors to Hope. It's very important that we are in community. Also, there is also a platform called Colectivo Esperanza. And, people can also go there and see, in what other ways they can accompany the community. So there are options out there, not only the three of us, but so many other organizations that are doing amazing work. And one of the things that we share with heart is that if one family is supporting, one of our organizations is actually supporting all of us at the same time. We are a very beautiful network of organizations that really respect and work in collaboration and trying, to in so many ways survive, not only financially, but also emotionally, while we are living our own stories and also facing the vicarious trauma that we are living right now.
Thank you for bringing up those other organizations too. Obviously, we can only get so many people on one of these, but there are several other groups, like you mentioned, that are doing really good work in our community. Edgardo, what can people do to help with Americana right now? I think you're still muted.
Better now?
Yes, now I can hear you.
Can you hear me? Volunteers are important. So if you go to our website, www.americanacc.org, you will have a link. If you know anything about how to create videos for children, if you can help our staff to find areas of expression and art that we don't have, would be amazing. If you had a chance to write cards and support our families to a positive message, hey, we are happy that you are here. Doesn't matter where you are coming from. You are my neighbor. You are part of my city now. We welcome you. So people don't understand the emotional stress that we are going through. A card with this simple thing, nothing sophisticated, piece of paper and not a very simple drawing, makes a lot of emotional impact in our families. If you have money to spare, we use the money to serve people. So we are like everyone else, food items, some help to pay the bills, medicines, provide some support to families, however, how we can make it. Money is a thing that normally we don't want to talk about, but I have a news for you. At the end of the day, mostly it's about emotional support and money. And it's like they are going together. So again, we are not rich. I know that most of the people around my life that are not rich, but we can share. So any of the organizations are worthy to make a donation. Doesn't matter how much, it's there.
Are you all getting any support from the One Louisville COVID Fund?
We got some, but it's a tricky thing there for families. If one member of the family doesn't have a social security number, the whole family is out of any kind of benefit. So this is part also how we are working.
It's like there's an obstacle course on top of the pandemic.
Yes.
Karina, it looks like you're nodding your head. You all are getting some funding from One Louisville COVID-19 Relief Fund.
We did get in the first round, to support the services that we are providing at this time. So we are very grateful, for the people that generously supported that fund. Something that people are asking us all the time, where do we donate? I would just say, in the spirit of abundance, just share where your heart is, where love tells you where the money needs to go. It's very hard to say go here or go there. It's just we like to see it as a beautiful a rainbow of our choosing, right? So people that are out there, just One Louisville, all of our immigrant refugees organizations, any of us will need the help. because in reality, Mike, you know, as John and Edgardo pointed out earlier, this is a matter of us realizing, you know, the discrimination, the systematic discrimination that is out there against anybody that is not from white mainstream, and anybody, you know, that falls into the minoritized category. That would be somebody that you know, it's an immigrant, is not heterosexual, is doesn't have an accent, and all those things. So by all of us being together and supporting, you know, our different anywhere in the city, I think it would be really beneficial for our whole city.
So I love your attitude about all of these things. You have this very positive outlook. John, is Kentucky Refugee Ministries getting funding from One Louisville as well?
We did get a initial allocation as an organization, and I do want to commend the leadership in this community for putting together that fund so quickly and making it available to our organizations. We didn't have to apply for it, and you know, a lot of funders make you jump through a lot of hoops, but I think people understood the critical urgency of the situation. And you know, as well, we're helping you know, refugees apply for direct assistance through the neighborhood places for that fund. But I think we're all, like unemployment insurance and the COVID-19 fund through neighborhood places, just such an overwhelming need for assistance there that you know, I think our governments are ramping up the staffing to respond, and I think they're doing a good job.
One of the things we've been doing with Louisville Pride is we do a weekly live drag show as part of Digital Pride. So Friday at 8 p.m., we just had the second week. So we've just started that, and it's hosted by Simone. And we have drag performers from Louisville that we pay to perform, and we use the money we raise towards the Louisville Pride Foundation, but also to the One Louisville COVID Relief Fund. So I'm very glad to hear that that money is going to your agencies as well. You know, it's one of those questions of, okay, we want to raise money, how do we, you know, contribute it? And so we picked that one as a fund that would be supporting several people as well. And that's part of this Digital Pride initiative, which is sponsored by UAW Local 862, Norton Healthcare, Connolly Law Offices, Evo Mortgage, and the Fairness Campaign. And I have one last question here for you all, and it gets into some of the policy stuff, which we've talked about a little bit, but you know, how is this impacting on a national level? How is this impacting immigration and asylum into the country? And then with that, we talked a little bit, somebody mentioned the census earlier. How important is it that immigrants and the international community are counted in the census? So John, we talked to you last, so do you want to start with that one?
Sure. I mean, where to begin? The refugee, I'll be brief, the refugee arrivals have been halted for understandable reasons. I think the virtual impossibility of someone applying for asylum at the southern border predated COVID-19, but I've just seen steps to interdict migrants, you know, before they even reach the border. And it's kind of a horror story, the detention centers, how they become hotbeds and of COVID-19 spread, and some of the transfers of migrants among multiple detention centers, some very dangerous and inhumane practices going on. So we'll see how it plays out in terms of policies, if there's any, you know, further attempts to kind of single out immigrants during this crisis. I hope not, but.
And Edgardo, you want to take that?
It's the kind of topic that I want to talk like for 5 hours. So I know that I had 25 seconds. It's a huge impact. It's not just for the pandemic, it's about before, well before. This goes back to the 3.7 million people that President Obama deported. It's going to know a political party. It's about the process that we have. It's about the kids in jail, in cage. It's about the people dying on detention centers without any kind of support. It's about the stress, knowing that some of the refugees right now are trapped without seeing families because they are coming from countries that they are bound to connect. It's about the people scared because you cannot renovate your green card. What's going to happen with you because suddenly you become undocumented. It's about the whole social system that we have. And this is simple about social injustice. And that is going to, we are going to pay a price. We don't know how many, at least I don't know how many immigrants are dying in detention centers. I don't know the number. I'm scared to find out what is the number. So that is a piece of reality that we need to start to research because it's affecting all of us. The other census is absolutely important that we fill out the census. I did it when I'm supposed to be done. So because A is about how we can get more federal money, you know that. B is about, hey, we lost one representative, we lost one congressperson, can we pick up the person? It's about education, but it's also about numbers. We have eternal conversation with the local authorities because they point out the census number, 76,000 immigrants. And I scream, normally say, no, we have over 120,000 immigrants. So when you make the comparison, is 1 every 6 residents is first generation immigrants. So again, it's perception, it's numbers, it's reality, it's people's life that can be changed if you fill out your census data.
Thank you. Karina, do you want to speak to that?
You know, in the spirit of recognizing who we are as a city, as a state, as a country, you know, we have, you know, who we are right now is because of the contribution of immigrants, honoring at all times that we, all of us and our ancestors came to a land that didn't belong to us, and that we are also accomplices with the times of slavery and the consequences that we have right now to our African American siblings. But with that, you know, also honoring that there are a lot of immigrants that came to this country for forever and always, that came with the spirit of wanting to have a better life for themselves. And wanting a better life, you know, running from persecution and from hatred and for so many things, from misery and poverty. So with that, you know, how we have been built up, you know, in our history of a very complex idea of honoring immigration, but having a broken immigration system. But at the same time, you know, through the years and through the decades that pass, we forget that history that brought us here in the first place. So with that, you know, like mentioning out there that we, all of us as a community, honor that history, make it real, and just asking ourselves, what are we doing? Are we just, you know, buying off all the ugly things that are being said out there? Even, you know, here in our own Louisville, 1850s, what happened to German and Irish immigrants? They were murdered because of the same reason of being immigrants and because they were Catholic. So when we look at that history, when we look at where we are right now, then that will give us the idea of what kind of policy needs to be changed. Where do we want to be? Do we want to continue oppressing everybody that we consider is a minority, which means less, or are we going to build up a community where everybody is included, where we honor, where everybody is with our different choices and orientations, ways of life, and how we can enrich each other with that? And in supporting John's and Edgardo's point, with the census, the idea of the census for a lot of people is, we want to count those that matter, and the rest of us then being invisible. My mother-in-law, who is 93 years old, she is Puerto Rican. That means she is a U.S. citizen. She has never done the census. This is the first year she's done the census, because I practically made everybody in my household fill out the census, right? So can you imagine? I mean, that so many people out there as well, because it is not explained, it is not promoted, and numbers are power. Numbers will give us the visibility that we need. What we are crying out there, knocking on every people's door and saying, we human too. We are also part of this society. And then when we elevate that, and when each one of us, our politicians, our service providers, our government, look at all of us just like fellow humans, I think that the policies and the changes and the rules and the way we see government, the way we see service, is going to change, because it's going to be looking at us as humans, not as things, not as commodities, not as tokens, but as real people that also feel and also enrich, this country, this state, this city. Louisville is an amazing city where we can all celebrate our different colors, our differences, and what our beliefs. But not everybody is as lucky and as blessed as we are to be in a community where we're having this conversation, Mike. How many places out there of Louisville are having this conversation openly? For us, at La Casita, just having the conversation this year was going to be our 4th year of doing the Latinx Pride at La Casita. We won't be able to do that. We won't be able to celebrate that physically, and then we can go on and on about that, about Indigenous Day, about Women's Day. We can go on and on and that. So how do we change the policy so everybody is included? That I think that's each one of us duty, not only politicians, but all of us, how we are making that change.
Mike, if I could briefly follow up, all 4 of our organizations preach civic engagement, civic participation, but we have many hundreds of refugees who've had who've been studying to become naturalized U.S. citizens and have had their interviews postponed. USCIS, their office is closed, and we have a number of people who've passed their interview, but to become citizens, but oath ceremonies are not being held, so they're not yet officially citizens. So that's just a sense of absolutely everything is halted in the lives of many immigrants.
Thank you all for joining me today for this community conversation on the impact of COVID-19 on immigrants and refugees here in Louisville. I want to thank you all, Edgardo Mencia from Americana Community Center, Karina Barrias from La Casita Center, and John Kohlinger from Kentucky Refugee Ministries. This is part of our Digital Pride initiative sponsored by UAW Local 862. We do community conversations Tuesdays and Thursdays at 1 p.m. And we have a live Digital Pride drag show Fridays at 8 p.m., which is a fundraiser for Louisville Pride and for COVID-19, the One Louisville COVID-19 Relief Fund. Before we leave today, I do want to just kind of ask you all each, I always like to end these on a positive note because we talk about so many serious issues. What are you doing personally to keep your spirits up in this weird time we're all living in? So who wants to go first on that one?
Why doing what?
What are you doing to keep your spirits up?
Oh, I got the question. I was just trying to be sarcastic. I personally, doing what I always do. I read, I pray, I meditate, but I also keep thinking of the person who needs the services that we can provide. And as long as we keep having this servant attitude, I'm fine with myself and with the people around me.
All right, who's next?
well. I'm not the biggest nature lover, and I live here in the Highlands near KRM, but I don't think I've ever spent more time walking around and looking at blossoming trees and spending time in Cherokee Park than I have in the past month. So.
And you, Karina?
Well, I come from a very resilient culture where, you know, going through anguish and pain and war and oppression, it's the norm. That was my norm growing up. So I am focusing on gratitude and then in resilience. You know, it's in my heart and feeling, you know, that all of this, whatever is happening to me, to my family, to my community, will help us grow and be better. And that's my hope. That's what holds me every day. You know, the hope that I know that deep in our hearts, this will change, you know, how I see myself, how I see others, and how we continue seeing each other as one, and how we can continue growing and evolving and making our community better. Maybe, you know, some of us might not see it, but it's my hope. And in this hope, I hold all my heart that my kids and the kids of my kids, you know, will see a better future. So that's what holds me every day, besides cooking and besides taking care of my plants.
Well, thank you all very much, and thank you for joining us. We'll be back Thursday at 1 o'clock to talk with Dare to Care. Until then, everybody wash your hands and stay safe.
Thank you, Mike.
Thank you. Thank you, Mike.
Gracias, adios.
Ciao.
All right. And